My name is Martine Mailloux. I work at the Chatham Health Alliance in the admitting department. I've been here 25 years as a registration clerk and admitting clerk. The admitting department is responsible for placing all the patients coming in for same-day surgeries, all the patients admitted through the emergency department and through other facilities that are being repatriated back or directly from doctor offices. So we do all the discharges, the patient placement, all the transfers, making sure that everything flows smoothly. You do your critical, so you go online and you tell the critical how many beds we have, acute beds, how many nursery patients we have, how many surgical beds are available. So if there's any kind of disaster or something, it's all across the lens, so you know where to transport your patients. Then we look at our same-day admit list, and depending on how many admissions you have coming in that day, you're trying to place your patients coming in according to their coverage. So if they have semi, you try and place them in semi. If they have ward, you try and place them in a ward. We flag all the MRSAs, the VRE patients, because those have to be either isolated together or in a private. And then we work a lot with the patient flow coordinator in placing our repat paper patients coming back from London. And we work a lot well with the emerge department, because on top of your same days, you also get all the emerge admissions throughout the day. So we have to make sure that all the floors the admissions are distributed evenly. We use the Oculus computer, which is broken down into floors. There's a section for the emergency department, and then every floor is broken down. The ward clerk or the nurses go into Oculus and flag the potential discharges or the for sure discharges. So that kind of gives us a heads up on how many discharges we're anticipating. It also flags them for any kind of isolation, MRSA or VRE. And then once you've received the admission from the emerge department, you can go in, click on that patient's number and place the room number. So everybody will be able to see where the patient will be going. And there's also a housekeeping part where if the room is not clean, it will say dirty, empty, dirty. If the room's occupied, it will say occupied. And if it's in progress, it'll say empty, dirty. And then once it's ready, it turns green and it'll say ready. So the emerge staff will know when the bed is ready, they can transport the patient. If anybody's looking for the patient, they can just click on that and they'll see the bed. The admitting job, it's like a big old puzzle. It's like you come in some days and you have 10 people holding an emerge and you have to figure out where you're going to place them according to, I always try and place them according to age, and of course you try to place them men with men and women with women, but it's a great teamwork. At the end of the day, everybody pulls together and we make it work.